Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. How are you?
Good morning, Doctor. How are you?
I'm here with John and Rob, my co-hosts, and
good morning, Dr. Lederman.
Nice to see you all, and hello to all our
Pleasure
listeners.
to be here.
Thank you. We have Coop and Aaron in the controls who are making this show so beautiful. We're live, so you're welcome to call in if you want. Our number is 1-800-848-9222. 800-848-9222. Because sometimes I forget to tell people to call in.
Sometimes we got to give them the number so they can call in.
So I want to dedicate this show to a woman I met this spring, and she died. She was a young woman, 39 years old, with Fanconi's anemia. Have you ever, Rob, heard of that disease?
I know it's related to the kidney.
Well, Fanconi's anemia, yeah, it's a genetic disease. It's very, very, very rare. Very, very rare. There's an anemia related to it. Fanconi was a doctor who described it. And for genetic reasons, these people are very predisposed to cancers of the head and neck area. And so it's devastating for the anemia, but that's only the minor part. The relationship to cancers is tremendous. And then the relationship to adverse outcomes to treatment is also dramatic. So this was a young woman. She went to a big hospital. You can imagine which one. And she got chemo, and she nearly died. She had one shot of chemo. She ended up in the hospital for 2 months and a nursing home for 4 months. This was a 39-year-old woman.
I was going to say, very young.
And the cancer traveled to the lung, and I proposed that we start very gently with radiosurgery, which is non-invasive, focused treatment, just to hit that metastasis in the lung. I thought it'd escalate the dose, show her that it'd be safe. And she was so frightened because of her bad experience with chemotherapy. And you can imagine 6 months in the hospital, she couldn't walk after chemo because of this disease, that she just refused all treatment. And her father called me yesterday to say that she died. So we had a nice relationship.
It's a shame.
And actually, she was very fascinated with radio. I met her last spring, and I told her, well, why don't you come on the show as co-host?
Oh, that'd be great.
And tell people about the disease and what it's like and your experiences. And she really wanted to.
Okay.
So it's really sad, and I dedicate this show to her. I can't use her name, but I'm sure her parents know what we're talking about. Well, believe it or not, when radiation oncology is in the news, something big is happening. And actually, headlines in Wall Street Journal this week were for radiation on Thursday, August 29th. And I've got the paper here, and you two can see it. Cancer therapy under attack. So it's pretty important news, because right now I see a lot of men with prostate cancer, and men justifiably are confused because they hear this treatment, that treatment, the next treatment. We get cut out the cancer and you're home free, and then they find out, well, you're not exactly free. The bill wasn't free, and the cancer's coming back.
Exactly.
And then all the side effects that stay with people forever. This article is about proton beam. So proton beam is fascinating because most radiation beams, once they get going, they keep on going. Mm-hmm. And we use photon beams, and we direct them from many different angles. You can imagine, like Star Wars, you have multiple angles that all converge on the cancer. So in a particular area of healthy tissue, there's no adverse effects, or almost no adverse effects, which is different than radiation used to be. Radiation used to be, and unfortunately in some places still is, by one side or two sides or four sides. And so a lot of healthy tissues get radiated. So proton beam, which has been around since the 1940s, it actually is not new, is trying to take advantage of what's called the Bragg peak. So the radiation goes in the body, it deposits itself, and then it stops. So that's the beauty of proton beam. So the question is, does it do any good? Is it better for the patient? And can you give a treatment without bankrupting the patient? And I was in Europe last year, and we were offering treatment for a particular kind of cancer. And the patient came with a letter from a big hospital in America, not far from here. And they were offering proton beam to this woman for $250,000.
Wow.
It was a normal family in Italy, and you
Sure.
can imagine, they probably make $1,000 a month, where they're ever going to come up with
$250,000, yeah.
$250,000. And here I was. We were going to do more work using radiosurgery, and the price was 5% of that.
A fraction.
Okay, 95% less. And I just, wow. I mean, they probably see my price and their price. I think something's wrong with me,
Sure, yeah.
but I think something's wrong with them.
There you go.
So anyway, and some people say that when your price is too low, people think, well, there must be something wrong with it.
What's that phrase? You price yourself out of the market.
Right, you
To a
price
degree.
yourself. You're too low.
Yeah, yeah.
So we're too low. And so this is a very interesting article, and what's talking about proton beam, and you can hear about it on radio in New York City. It's
Right.
and across the nation. Multiple insurance companies are now stopping covering for proton beam.
Why
Just
is
that treatment alone, doctor?
Just that
Okay.
treatment alone. That treatment alone. Why? Well, you can imagine if your insurance company, you've got so much pie to pass around,
Yeah.
and you'd want to know, is the treatment better? Right? And in 60 years of proton beam, Rob, you know how many studies have shown proton beam is better than photon beam in 60 years?
I have no idea.
John?
I wouldn't know either. I'm assuming. So.
Well, think about a big goose.
Okay.
And what does a goose lay?
Eggs.
And when you hear about a goose egg, what does that tell you? How many studies? Zero.
Not too, I was going to say,
Zero.
on the lower side.
Okay,
doctor.
so when you have insurance companies that are asking to pay tens of thousands of dollars for treatment that are not better, what are they going to do? They're going to start running away.
Right.
So either they're doing one of two things. And the insurance companies, I think Aetna has stopped covering. Blue Cross of California has stopped covering. Blue Shield, they sent letters to 300 radiation oncologists saying in October it will no longer cover proton beam for early-stage prostate cancer.
Wow.
Aetna, the third largest insurer, is stopping coverage for prostate cancer proton beam. And the change, they said, is, quote, designed to help members across America access safe, effective, and cost-effective strategies. Cigna's going to review its policy this year. Highmark and Blue Cross Blue Shield of Kansas City have positions against it. And WellPoint, which is a very big insurer,
Sure.
it's very big.
Yep. They're a national insurance carrier.
So they're doing the opposite. They're saying, okay, we'll cover it, but we're going to negotiate the price down.
Okay.
And they're so big, maybe they'll negotiate the price down. But then you get into data about what's what. So the typical man, we spoke about Gleason score. Do you remember that?
Sure
Yeah.
do.
So what is Gleason, John? I know Rob knows all this stuff because he's a doctor to be.
Remind me there, Rob.
So basically, it looks at two different parts of the prostate cancer.
Right.
And so through that, you can tell basically how advanced it is or,
Okay.
or how serious it is.
Right. So you can see there's a scale of 1 to 5. So in two areas, 1 + 1 = 2 is the best you can have, which I've seen thousands of men. I've never seen that. It doesn't really exist. But the worst, 5 + 5 = 10, does exist, and it's very aggressive. The average man with prostate cancer has a Gleason 3 + 3 = 6. So if you have Gleason 3 + 3 = 6 or 4 + 3 = 7, proton beam success rate for prostate cancer is 76% at a leading center in America. We are at 87%, so 14% better. And if you think about 200,000 men a year with prostate cancer, 14% means 28,000 lives. So it's huge differences.
Yep.
These numbers are huge. And if you have higher Gleason score, Gleason 8, 9, 10, and you go for proton beam, the success rate is only 48%, meaning the majority of the men treated with prostate cancer have recurrence of their cancer. We're 46% higher. We're at 70%, even for those high-risk men. And we do it in less time. And we do it for less money. So if your insurance company, if you can do